What if the single biggest factor making your diabetes harder to control is not what you are eating, how much you are exercising, or even your medication dosage, but something as fundamental as the timing and temperature of the water you drink throughout the day? I know you are probably highly skeptical right now. You have spent years trying absolutely everything. You have tried different medications that came with side effects. You have endured restrictive diets that left you feeling miserable. You purchased expensive glucose monitors and tried supplements that promised miracles but delivered nothing. And here I am telling you that plain water could be the missing piece of the puzzle. But stay with me, because what I am about to share has helped many people see meaningful drops in fasting blood glucose within just a few short weeks. These are not just cold statistics from research papers. These are real people who walk into my clinic every single day feeling exhausted, confused, and frankly completely defeated. I am talking about folks in their mid-60s through their late 70s who do everything by the book. They check their glucose 4 times daily. They memorize the glycemic index. They measure carbohydrates down to the exact gram. They walk religiously after dinner and take their metformin with absolute clockwork precision. And yet, despite all of this immense effort, their morning numbers are still all over the place. I see the profound exhaustion in their eyes. It is the kind of soul-crushing fatigue that comes from fighting a relentless battle where the rules keep changing and victory feels utterly impossible. These are wonderful people who have given up the pasta and sweet desserts they once loved. They spent thousands on continuous glucose monitors and every diabetes education class their insurance would cover. And despite all of it, their blood sugar levels keep climbing. Here is what changed my entire approach to treating diabetes. I began noticing a crucial pattern. I realized that a massive portion of adults over age 65 are chronically dehydrated. And that specific dehydration creates a cascade of severe metabolic problems that make blood sugar control nearly impossible regardless of how much medication you take. Most medical research focuses entirely on what people eat. Almost nobody studies when and how people drink. Before we continue, I am incredibly curious. Where in the world are you watching this video from right now? Please drop your location in the comments below. Now, before I explain the biological mechanisms, I need to be crystal clear to comply strictly with health guidelines. This video is strictly for educational purposes and is not a cure. Do not ever stop taking your prescribed medications without consulting your primary doctor. Your doctor and their treatment plan matter immensely. What I am sharing today is simply how to optimize the internal environment of your body so your prescribed medications can actually work exactly the way they were designed to work. Let me explain what is happening metabolically inside your body that almost nobody tells you about. When you hit your 60s, your body undergoes 4 critical biological changes that directly impact your blood sugar control. First, your cellular water channels, which are specialized proteins called aquaporins, become significantly less responsive. Even when you do drink water, your aging cells actively struggle to actually pull that life-saving water inside, where it is desperately needed. Second, your kidneys naturally lose approximately 30% of their filtering capacity by the time you reach age 70. Because of this natural decline, they are less effective at removing excess glucose from your bloodstream. They are also less efficient at concentrating your urine, causing you to lose far more water than necessary. Third, your natural sense of thirst becomes dramatically impaired. Clinical studies show that by age 65, your thirst response can be delayed by up to 90 minutes after your body desperately needs water. You could be medically dehydrated without feeling even slightly thirsty. Fourth, many common diabetes medications, especially the diuretics that people take for blood pressure, actively pull water directly from your body, making chronic dehydration significantly worse. Here is the massive secret. When your cells are dehydrated even by just 3%, your cell membranes become highly rigid. I want you to think of a dried-out stiff kitchen sponge versus a soft, moist sponge. A dried sponge cannot absorb anything, but a moist sponge pulls in liquid instantly. Your cell membranes work the exact same way. When they are properly hydrated, your insulin receptors function normally. When they are dehydrated, those receptors essentially shut down completely. Your pancreas could be producing plenty of insulin. You could even be injecting insulin. But if your cell membranes are rigid from dehydration, that insulin physically cannot do its job. The tragic result is that your glucose stays trapped in your bloodstream instead of successfully entering your cells. Your blood sugar numbers climb dangerously high. They climb not because you ate wrong or forgot your daily medication, but because your cells physically cannot accept the glucose trying to enter. To make this perfectly clear, let me tell you about my patient Robert. Robert is 69 years old. His diabetes had been perfectly stable for 8 years. Then suddenly, without changing a single thing, his morning numbers went completely haywire. He had been comfortably waking up with readings around 110 to 120. Now he was consistently hitting 170, 185, and sometimes breaking 200. His daughter brings him in because she is deeply worried. When I review his glucose log, the pattern is completely mystifying. Tuesday morning is 192, Wednesday is 178. Thursday is 201. He eats the same dinner every night. He has plain chicken breast, vegetables, and brown rice. He has the exact same bedtime routine and medication schedule, but he gets wildly inconsistent readings. Picture his loving daughter leaning forward, saying that he is doing everything perfectly, and they weigh everything but something is clearly wrong. I calmly walk through his typical day. On paper, everything looks textbook perfect. Then I shift to a different angle. I ask Robert to walk me through his fluid intake. This is where the hidden pattern finally emerges. He has coffee when he wakes up. He has a small glass of water with his pills. He has another glass at dinner, and sometimes an iced tea. When I ask about plain water, he admits he drinks maybe 2 small glasses total. He is never really thirsty, so he does not think about it. At 185 pounds, Robert needs approximately 90 ounces of water daily. He consumes maybe 16 ounces. He is chronically dehydrated, but his impaired thirst mechanism gives him absolutely no warning signal. We immediately implement my specific hydration protocol. We restructure when and how he drinks. Just 10 days later, Robert reaches out. His tone is completely different and excited. He tells me his morning reading was 118 today, and he has not seen these numbers in 6 months. 4 weeks later, the transformation is fully visible. His glucose log shows an average fasting reading of 127 for 2 straight weeks. The only variable that changed was strategic hydration. He tells me the mental fog has completely lifted. That mental clarity is exactly what happens when your brain is finally properly hydrated. The details of Robert's story vary from patient to patient, but the core issue is almost always exactly the same. Before I teach you the exact WTR protocol that works in cases like his, let me explain the 3 critical mistakes nearly everyone makes with hydration after age 60. Understanding these biological errors is vital from an educational standpoint because you cannot fix a metabolic problem if you do not know what is actively causing it. I guarantee you are probably making at least 2 of these mistakes right now. Mistake number 1 is counting coffee, tea, and other beverages as water. Here is the absolute truth from a medical perspective. Coffee and tea are mild diuretics. For every single cup you drink, you lose approximately 60% of that volume through increased urination. If you drink 8 ounces of coffee, you only net about 3 ounces of actual hydration. The rest is pulled directly from your body's existing water stores. Think of it like this. If you have a checking account that needs $1,000 to avoid overdraft fees, would you deposit $1,000 knowing the bank immediately withdraws $600? You would still be dangerously short. Additionally, drinking unsweetened juice causes rapid blood sugar spikes, while diet sodas contain artificial sweeteners that actually worsen your insulin resistance. The only beverage that truly hydrates your cells is plain water. Mistake number 2 is drinking cold water straight from the refrigerator, especially first thing in the morning. This might surprise you because cold water feels incredibly refreshing. But physiologically, here is what happens when ice-cold water hits your stomach while your core body temperature is still low from sleep. Your blood vessels immediately constrict. This is an automatic stress response as your body desperately tries to maintain its core temperature. When blood vessels constrict, your circulation decreases dramatically. Since glucose needs to travel through your bloodstream, constricted vessels mean insulin and glucose cannot reach your cells efficiently. Furthermore, cold water on an empty stomach shocks your digestive system, triggering a response that releases cortisol. Cortisol then signals your liver to dump stored glucose directly into your bloodstream. You have just created a morning blood sugar spike before even eating breakfast. Mistake number 3 is drinking large amounts of water only when you finally notice you are thirsty. Remember, by the time you feel thirsty at age 65, you are already significantly dehydrated. What do most well-meaning people do in this situation? They drink 16 or 20 ounces all at once, thinking they are fixing the problem. Biologically, your intestines can only absorb approximately 8 ounces of water every 20 minutes. Anything beyond that amount simply passes through to your bladder and comes right back out. It is exactly like trying to water a completely dry garden with a high-pressure fire hose. The ground cannot absorb it fast enough, the water runs off, and the roots stay dry. Proper cellular hydration requires small, frequent amounts throughout the day, like maintaining a constant, gentle rain instead of a massive downpour. I want you to pause for a moment and reflect on your own daily routine. Which of these 3 hydration mistakes have you been making without even realizing the biological impact? Are you a chronic coffee drinker, a cold water lover, or a fire hose chugger? Please scroll down right now and tell me in the comments below. Now let me teach you the exact protocol I use with my patients. I call it the WTR protocol. W stands for water pure and strategic. T stands for timing the schedule that optimizes glucose control. R stands for regulation, the way your body learns to predict and respond. First, water quality matters significantly more than most people realize. Tap water is generally fine if your municipality has good filtration, but I highly recommend filtered water if possible. Here is my specific clinical recommendation. Use filtered water and intentionally add back trace minerals. Why do we need these minerals? Your aging cells do not just need plain fluid. They desperately need electrolytes to create the vital electrical gradients that physically allow glucose to enter the cell. Think of minerals as the specific keys that unlock your cellular doors. Drinking water without minerals is exactly like showing up at a locked door with no key. Specifically, magnesium is absolutely crucial for proper insulin function. Potassium directly helps regulate your overall glucose levels, while sodium in appropriate amounts is biologically essential for driving cellular hydration. My recommendation is to add exactly 5 drops of trace mineral solution to every 32 ounces of water you drink throughout the day. Now we move to the T in our protocol, which stands for timing. When you drink, your water is equally as important as what you are drinking. We divide the day into 4 strategic hydration windows. Window number 1 happens immediately upon waking up. You must drink 12 ounces of room temperature water mixed with trace minerals. From a physiological perspective, this does something truly remarkable for your health. After sleeping deeply for 7 to 8 hours without any fluid intake, your blood has literally thickened overnight. Your first deliberate drink of the day rapidly rehydrates your bloodstream, allowing your blood to flow much more easily and deliver insulin far more effectively. Additionally, drinking water first thing biologically signals your hypothalamus to wake up your metabolism very gently. This precise action actively prevents the severe cortisol spike that causes the dreaded dawn phenomenon. The dawn phenomenon is that frustrating morning blood sugar rise that seems to come from nowhere despite a perfect diet. In clinical cases, this single morning step often drops fasting glucose by 30 to 35 points on average. Window number 2 occurs exactly 30 minutes before each of your main meals. This specific timing is incredibly critical for digestion. You need to drink 8 ounces exactly 30 minutes before you eat your breakfast, lunch, and dinner. Not 15 minutes before, and definitely not right while you are actually eating. Why exactly 30 minutes? Educationally speaking, this gives your stomach adequate physiological time to prepare. It naturally activates digestive enzymes and begins to dilute your stomach acid to the optimal concentration for breaking down solid food. Most importantly, for your overall blood sugar control, it physically slows down gastric emptying. When food moves much more slowly from your stomach into your small intestine, your carbohydrates are absorbed much more gradually. This biological process creates a very gentle rise in blood sugar instead of a massive sharp spike. Your naturally available insulin can actually keep up seamlessly with the incoming glucose. Clinical studies conclusively show this single daily habit can reduce your post-meal glucose spikes by up to 35%. Window number 3 focuses on the mid-morning and mid-afternoon periods directly between your pupil and presymbiome. Meals. This is the exact time when most individuals see their blood sugar do highly unpredictable things. You are not eating anything, so you naturally assume your daily glucose should remain perfectly stable. But then you check your monitor and your numbers have climbed 20 or 30 points for absolutely no apparent reason. As your blood naturally loses water through normal baseline metabolic processes, it becomes highly concentrated. More concentrated blood automatically means higher glucose readings, even though you have not added any actual sugar to your internal system. To actively prevent this, you must gently drink 6 to 8 ounces at 10:30 in the morning and again at 3:30 in the afternoon. These carefully timed small amounts keep your total blood volume consistent and your glucose readings remarkably stable throughout the day. Window number 4 happens exactly 2 hours after your last meal of the day. That common advice to avoid water before bed is partially true. Drinking a large glass of water at 10 at night and going to sleep at 10:30 means you will inevitably wake up at 1 in the morning desperately needing the restroom. But drinking your final water at 7 or 8 in the evening, which is a full 2 to 3 hours before going to bed, allows your aging body ample time to carefully process and distribute that essential fluid. You will likely urinate one final time right before bed and then sleep peacefully through the night. This evening hydration routine does something completely critical for your baseline fasting morning blood sugar. It physically prevents your blood from thickening too much while you sleep deeply overnight. This fundamentally means you wake up with significantly better circulation and far more stable morning glucose readings. Finally, we reach the R in our comprehensive protocol, which stands for regulation. Your body constantly adapts to patterns. If you have been chronically dehydrated for many months or years, your body has biologically adjusted to function in a physiological drought mode. Your kidneys actively concentrate your urine much more strongly. Your brain forcefully suppresses your natural thirst signals. Your cellular membranes rigidly accept much less fluid. When you suddenly start drinking significantly more water, your body initially responds by sending you to the bathroom constantly. Your body is simply safely recalibrating its complex internal systems. Unfortunately, most people quit this process after just 3 short days because the frequent bathroom trips become highly annoying. But you must understand what beautiful metabolic things happen if you stay strictly committed. Within 10 to 14 days, your kidneys biologically adjust to the new volume. Your bladder physically learns to gently hold more liquid comfortably. Most importantly, your aging cells successfully begin accepting more vital water. The bathroom urgency decreases dramatically while your true deep cellular hydration finally improves. This is the critical regulation phase. You are actively teaching your body to trust that fresh water is consistently available, so it no longer needs to rigidly stay in a metabolic crisis mode. Additionally, drinking water on a highly precise daily schedule trains your natural circadian rhythm. Your body begins naturally anticipating these hydration windows and powerfully prepares your metabolism accordingly. This gradually creates remarkably stable blood sugar patterns over sustained time. So what should you realistically expect when you bravely implement this protocol? Let me outline the exact timeline week by week so you have proper educational expectations. During week 1, you will absolutely be visiting the bathroom much more than usual. It is admittedly annoying, but your body is actively flushing out years of accumulated metabolic waste. You simply must push bravely through this very first week. Regarding your blood sugar, you might only see very small initial improvements, maybe 5 to 10 points lower on average, but nothing overly dramatic yet. Moving forward into week 2, the bathroom frequency finally starts fully normalizing. Most of my regular patients happily report that by day 10 or 11, they are no longer constantly looking frantically for public restrooms. Your blood sugar readings will begin wonderfully showing much more daily consistency. They might not be massively lower every single time, but you will undoubtedly see far less random, frustrating variation. The massive, confusing spread between your highest and lowest glucose reading each day starts rapidly and visibly narrowing. Week 3 is exactly where dedicated people typically experience their massive, wonderful breakthrough moment. Your morning fasting glucose begins dropping very noticeably, often securely 15 to 20, or sometimes 25 full points lower than your previous baseline average. Your stressful post-meal glucose spikes become highly predictable and much less severe or dramatic. Most importantly, you truly start physically feeling completely different. Your daily mental clarity greatly improves, and that heavy, miserable afternoon energy crash significantly lessens. Many patients even joyfully tell me their chronic joint pain decreases safely because systemic bodily inflammation drops significantly when you are finally properly deeply hydrated. As you reach week 4 and move continuously beyond, your overall blood sugar control continues safely improving. Many highly dedicated patients remarkably see their important A1C numbers reliably drop by 0.5 to 0.8 points over a full 3-month medical period. Some patients working strictly under medical supervision can even safely, effectively reduce their prescription medication dosages. The typical happy feedback I regularly receive at the 12-week mark sounds exactly like a patient joyfully declaring they have not had a single terrifying glucose reading over 160 in 3 solid weeks. To make this incredibly clear, let me share one final patient story. Linda is 73 years old and had been managing type 2 diabetes for 16 years when she came into my office. She looked visibly defeated. Her endocrinologist said she needed to start insulin because her A1C had climbed to 8.9. She was already on 3 oral medications and felt like she was failing. She was terrified of needles, and the thought of injecting herself daily was overwhelming. Her daily water intake was roughly 20 ounces. Her skin had the papery texture of chronic dehydration, and she reported constant fatigue. When I explained the water timing regulation protocol, she was highly skeptical. Drinking water seemed far too simple to make a meaningful difference, but she was willing to try anything to avoid insulin injections. We started immediately. The first week was challenging. On day 4, she felt she was living in her bathroom, but I encouraged her to push through. By week 2, things shifted. Her bathroom trips decreased, and she slept through the night for the first time in months. Her morning blood sugar was 148. It had not been below 175 in half a year. By week 3, the change was visible with better skin color and easier movement. Her average fasting reading was 139 and post-meal numbers rarely exceeded 165. Before the protocol, she regularly hit 230 after eating. At 3 months, her A1C dropped from 8.9 to 7.7. Her endocrinologist called to say they were holding off on insulin. 6 months later, her A1C reached 7.2. The insulin conversation was permanently off the table. Linda shared a profound realization. She had spent 16 years meticulously managing her diet, exercise, and medications. She managed everything perfectly, except the most fundamental thing her body needed, which was water. She was running her metabolic engine on empty and expecting it to perform perfectly. This brings us to the most important educational takeaway of our entire discussion. You can rigidly count every single carbohydrate. You can walk precisely 3 miles every evening. You can take your prescribed medications with absolute clockwork precision. But if your cellular membranes remain chronically dehydrated, your body physically cannot utilize the insulin it creates. Your glucose inevitably remains trapped, circulating dangerously in your bloodstream. Proper strategic hydration is the foundational biological environment that allows every chemical reaction in your body to occur. Diet and exercise are the fuel, but pure mineralized water is the essential oil, allowing your metabolic engine to run smoothly. Health often depends on mastering these simple, overlooked biological basics before completely relying on complex medical interventions. I must be absolutely clear about vital medical precautions to ensure your safety. This precise protocol is not a completely magical cure for diabetes. It will never fully replace your necessary medical treatments. You must never stop taking prescribed medications without explicit approval from your primary doctor. What this specific protocol realistically does is actively optimize your internal cellular environment so your prescribed medications work much more effectively. There are specific conditions requiring extreme caution. If you have congestive heart failure or any serious condition where bodily fluid retention is a clinical concern, you must speak directly to your cardiologist before ever increasing your water intake. In severe cardiac conditions, drinking excessively can dangerously worsen internal fluid retention. If you have advanced kidney disease, especially on dialysis or with less than 30% kidney function, you absolutely need individualized medical guidance from your nephrologist. Finally, if you are taking powerful diuretic medications for high blood pressure, your doctor might actually need to safely adjust your daily dosages as your natural hydration improves. Proper hydration powerfully lowers blood pressure naturally, which might unexpectedly make your current medication dose slightly too strong. Always watch for highly unusual signs of overhydration like urinating completely clear fluid more than 10 times daily or suddenly developing severe headaches. We have comprehensively covered a massive amount of vital biological information today. We carefully examined the specific physiological changes causing hidden dehydration in seniors and detailed the precise daily protocol of water quality timing, windows, and bodily regulation. If you have made it absolutely all the way to the very end of this detailed presentation, I want you to immediately type the exact words I finished the video in the comments section below. Typing those specific words gracefully tells me this vital health information is successfully reaching the dedicated people who truly desperately need it. It also wonderfully helps the platform algorithm proudly share this educational video with thousands of other seniors struggling with their daily blood sugar management. I deeply want to warmly invite you to thoughtfully share your personal health journey with our growing global community. Please kindly tell me in the comments exactly where you are starting from today. Then confidently come back and proudly let me know how you are feeling after week 1, week 2, and week 3 of diligently implementing this exact protocol. Your completely honest personal story could uniquely be exactly the precise, powerful inspiration someone else desperately needs to read today to finally give this entirely natural approach a dedicated try. If you found practical, educational value in this free presentation, please gently hit the like button right now. Generously share this video with a beloved family member, parent, or friend who is painfully struggling with their blood sugar despite doing everything right. This simple, fundamental information could completely change their life trajectory. If you have not joined our community yet, please hit that subscribe button and click the notification bell. I dedicate myself to posting brand new researched educational videos every single week, focused on naturally managing diabetes, optimizing metabolic health, and living vibrantly well after the age of 60. Thank you for being here. Today, thank you for taking your precious health seriously enough to thoughtfully watch a comprehensive educational presentation about something as basic as drinking water. Please remember that sometimes the most powerful medical interventions are not the technologically complicated ones. Sometimes simply getting the fundamental biological basics right creates the most profound, beautiful health transformation in your life. Please take excellent care of yourself and your beloved family. This is Dr. Eric Lawson, and I will see you in the next video.